Hey guys, so today I wanted to talk about kind of approaching getting help with your airway. I'd probably say in the last few weeks I've gotten probably 40, 50 messages, especially from a lot of people outside of the country, I think, that don't have access to a lot of stuff we have. A lot of people in Canada that basically have to get in a long line to kind of wait with limited access. So what I want to talk about today is just kind of like some of the big things that people typically message me about, and just kind of give some opinions on how to possibly approach the whole situation. You know, for me, I'm not a doctor, basically an informed citizen that's read a ton of books, medical journal articles, had a number of these procedures done on myself, and have just asked a lot of questions to a lot of great doctors and practitioners in their field to just try to continue to learn. And I think this is an evolving science, and I think for the most part it's kind of new in the sense of kind of all the fields a lot of this stuff crosses. So I think as far as getting some help, I think it's important that people start to understand like how to approach that. And I think the first thing is, oftentimes people reach out about stuff they're doing currently to try to help themselves. And I think oftentimes they haven't even seen someone, and what they're doing could possibly make things worse, or just kind of lack of understanding of why they're doing what they're doing. I just see a lot of people just kind of in need of some assistance and education when it comes to this, so they can start to take better steps, right? The first thing with all of this is educating yourself. Pick up a few books, some medical journal articles, but just start to kind of read about some of these things, because I feel like if you were to go to see a doctor with some of these things, you oftentimes don't even know what to ask. And if you don't really know what to ask, do you really know how to shop for the right doctor? Because I think when it comes to a lot of this stuff, there's a lot of nuance and intricacy, and some doctors do this, and you might find the same doctor in that field in a different state, and they only do one thing, or they do different things. So for you, understanding what you would like to be seen for and knowing that the doctor has experience with those things, I think that's very helpful to start to approach how to find the right practitioner. I think one of the worst things you can do in this world is count on your pediatrician or count on your general doctor. And I just feel like a lot of this stuff wasn't taught to them in school, so it's not anything on them. I just feel like a lot of this stuff is evolving science, and you'll find some orthodontists that literally they just straighten teeth. And then you've got others whose philosophy is, airway first, teeth second. And they can be great guys, gals with families, and they work hard, but it's kind of like what they know. And I think relative to getting the right help, it's important to find a doctor or a practitioner that understands, what it is you're looking for. And this is where the education comes in, because if you kind of don't understand enough of it, you almost don't know how to interview doctors. You don't know how to kind of parlay what the first doctor or practitioner might say to go to the second one, and kind of how to move forward. But some of the major stuff I wanted to talk about from an airway perspective, you got TMJ pain, teeth grinding, bruxism, sleep apnea. So you've got central, OSA, you've also got UARS, chronic neck pain, low back pain, face pain, headaches, someone's a mouth breather, someone's got a deviated septum, high arch palate, teeth are chipping, scalloped tongue, tongue tie, lip tie, sinusitis, crossbite, overbite, underbite, low tongue, and there's about 1 million more of these. But these are some of the big ones I just kind of want to talk about today. And I think the first thing when you start to educate yourself is kind of understanding like the different categories that might be the best place to start. Like I said, like I'm going to see Dr. Zagi in LA on Wednesday next week. But here's a guy who at the Breathe Institute, he basically has schooling in both ENT science as well as sleep science. So here's a guy that can literally sit down, have you come in, evaluate you, and literally like a one-stop shop. He's aware of everything in this world. He's got myofunctional therapists, craniosacral therapists, he has orthodontists there, as well as he can do all sleep testing, all that stuff. So there's a prime example of like getting on a plane to possibly get evaluated by the right person, even if you're not going to get treated by him, so that you have someone that has a global perspective of all these pieces, what fits, that can hear your story. He can ask the right questions, do the right testing, and now he is basically like all the way at the top of the ladder looking down at this complex puzzle as far as trying to help you out. Now I'm aware that there's a lot of people that live in small towns or they live outside of this country that don't have access to that. And you know, even for me in Scottsdale, Phoenix, Arizona, it's like one of those things where I've had to piece my team together here. But I mean, I've flown to Carlsbad, I've flown to New York, going to LA next week, and I've realized that like, depending on how bad things are health-wise for you, it's like getting the right help. But, you know, even for me, about a little over a year ago, I flew to New York to see my 4th sleep doctor, because what I found was there's distinctions in sleep medicine that if people don't really understand them, you typically kind of slip under the radar when being diagnosed, and then you tend to be told you're either okay or they set you up on a CPAP, and oftentimes it won't work because of basically what's really going on. It's not being addressed by how they set the pressure. But I was able to see him, get evaluated, and then he also, Dr. Gold in Stony Brook, New York, he worked with a facial surgeon, and they kind of work together as a team. And then he's also has orthodontist dentists in the area he's been doing this with for 20 years. So I basically came in, sleep tested the first night, second night he titrated me for a CPAP. And then after I got all those results, I then went to see the facial surgeon. And what the facial surgeon did was do like a 3D CT scan. So he was able to look at my jaw, my airway, tongue posture, and then see my pharyngeal airway, which is basically like the pipe in your back of your throat. Like, how wide is it? Like, do I have enough room? But all these things matter when you start to understand like what they all do. This is where kind of the education part is very important. But as far as some of these things, you know, the first one being like an ENT. So I remember I went and saw an ENT here, Ivy League education, but here was a guy that was like anti-expansion, didn't know anything about tongue ties, but really good surgeon. And I ended up having like my tonsils, adenoids, deviated septum, uvula all removed. So when it starts to come to some of these things, it's like, can you find a one-stop shop close enough to you? If not, it's kind of like figuring out like what are the most dire symptoms, what needs to be addressed first, and then from there kind of, if you don't have good access, at least starting to take action. As long as someone's not cutting on you, I think as you start to find practitioners and read more and more as you're trying to heal, I think you'll start to understand more, and all this will lead to you kind of finding the right doctor, the right practitioner to kind of help you get going. But from like an EMT perspective, you know, some will just go in, take a look at your nose, that's it. Versus Zaghi out in LA, he'll take a 3D CT scan. He does tongue tie, lip tie release. He does sleep testing. He'll look at your airway. He has access to orthodontists and dentists that do expansion, children, adults, myofunctional therapists, craniosacral therapists, but all these things are components or like tools to basically rebuild your house to be more efficient. But when it comes to the ENT, you know, you've got back of the throat, someone obviously checking your nose, turbinates, deviated septum, you know, chronic sinusitis, what's going on. You know, maybe they're addressing allergies related to pollen, mold, maybe it's food allergies. Someone that kind of understands like how to help you. Not a ton of ENTs out there specialize in sleep, but there are some that do. So now you get someone that can look at your airway and your sleep. All I'm doing is giving distinctions here because there's a plethora of good doctors that are kind of standalone, and then there's other doctors that kind of tether multiple fields. And when it comes to airway, those that understand not just their lane, but the surrounding lanes, very important to kind of have someone with more global perspective on how what they're going to do helps you, or other factors that relate to what they do, and kind of how to get you the best help. Because one of the things I also found in this world is you can find someone that specializes in palate expansion, but the one thing might be is they only do one type of palate expansion. Well, based on if you had the choice of every different kind, is the kind they do the type that you need? And this is where like educating yourself and maybe seeing multiple doctors in the same field. So you've got a ABC, what do they all say? What is similar, what's different? Asking questions, how do I figure out like what it is that I need? Because I just got 3 different opinions, but really understanding that. The other thing is, you know, you've got some ENTs that do tongue tie, lip tie release. Some of them have myofunctional therapists on staff. If that's something you don't have access to, whether you're out of the country or in country, for the most part, you can find awesome people like on my IG page that literally do it all online. They'll send you a kit so that you have all the stuff you need to do the exercises, but they can do the evaluation right there. And for the most part, I'd probably say 90% of people, like things that need to be seen can be seen by this person. You know, even for someone that's not sure if they have a tongue tie and maybe they don't have access to someone locally, you know, here's a situation where you could literally do a Zoom consult with someone like at the Breathe Institute or some of these other places. And then that person that lives in that world might be a good sounding board to see like, okay, I do have one, or no, I don't have one, and starting to kind of get some information. The next part of this is the sleep specialist. So one of the things with sleep that I see is that many doctors are good at kind of diagnosing OSA. So OSA is like basically you think like overweight guy in the corner during the day, falls asleep, you know, snores loud, tends to have issues with, you know, basically snoring, issues with like hormones, insulin levels related to like diabetes, those types of things. You know, many doctors are great in this OSA or central apnea, kind of diagnosing that. What I found is a lot of your young, skinny, fit, you know, females or even males that maybe don't even snore tend to go get tested, and then they test people against OSA standards, and many of these doctors, not knowing enough about UARS, these people kind of slip through the cracks. So one of the things that I found from Dr. Gold when it comes to the UARS is whether you're doing an at-home or in-lab sleep test is making sure that that test has a nasal cannula. so that they're able to look at your flow at the nose while you're sleeping, because there's those that don't think they snore, but it's just not at a frequency that you can hear it. So it's called silent snoring. So that's not to say you don't, but oftentimes UARS patients, if they're kind of use OSA standards to look at their sleep, maybe their apneas are only 8 seconds, they're not 10, and a lot of times people with UARS don't tend to have the same things that they look at in OSA, but OSA, they're typically looking for apnea, hypopnea, desaturation levels, whereas UARS, you have a lot of your functional somatic syndromes. People basically, when they go to stand, they feel faint, dizziness, chronic back, neck pain, fibromyalgia, chronic fatigue. I think a lot of times, like your kids with like ADHD or hyperactivity, from all the studies I've read, a lot of times fall into that category. So especially kind of getting evaluated by the right person when it comes to this and doing your homework is key. I think the other thing with sleep is I have so many people I've talked to, even good friends of mine, that know they have sleep issues, but they're like, I don't want to do surgery and I don't want to wear a CPAP. But there's a lot of good stuff out there nowadays. I mean, there's expanders that you literally wear to bed every night that will expand your jaw, non-surgical, that just kind of activate the stem cells in your palate. There's different devices to kind of move your jaw forward, which is basically like a TMD device to open up your airway to ensure you're sleeping better. And I think some of these things get you part of the way with relieving some of the symptoms, or maybe they work for now, and then oftentimes it's not enough down the road as we age. Our breathing gets worse, our bodies get older, less efficient, and those same things are no longer being addressed by some of those kind of tools that they used earlier on. But I think for a lot of people, it's like, hey, what's the best low-hanging fruit that I can start to address? And then how do I start to go up the ladder? What doctors do I see? What am I willing to do? And I think a lot of times people that aren't willing to do certain things as they get older and maybe things get worse is the same thing that was once brought to their attention, they're now ready to take action on, versus that sounds like a lot, I'm just not there. Next thing being myofunctional therapy. I think this is a game changer. I think people that are gonna have procedures done on their jaws, someone that does some type of palate expansion, someone that's got low tongue posture, if your tongue has never lived on the roof of your mouth and you don't have good suction, a few things happen. You don't swallow properly, you don't pressurize your body properly, which affects your posture for the rest of your life. A lot of times if your tongue isn't in the right place on the roof of your mouth and living there, basically our nervous system doesn't stay balanced. So how we parasympathetically basically rebalance our body is when our tongue's in the right place. And that's kind of almost like our natural method of basically calming our bodies down, both when we sleep and during the day. But how we swallow can affect, everything from, our tongue posture is going to be more of a tongue thrust. We don't suction, so as we take in food, liquids, we don't have the right strategy in place, and oftentimes that puts undue stress on our jaw, our neck, our head, and over time these things start to add up. But myofunctional therapy, a lot of times you'll find doctors in these worlds too, as you get procedures done, that won't even bring it up. It's not even something talked about. But for someone looking to do palate expansion, someone that's got tongue issues, maybe it doesn't sit on the roof of their mouth, maybe their tongue doesn't fit, these are some awesome things that you can start to do in conjunction with these other avenues to get more benefit out of whatever you're doing. And I think it's kind of like one of those things where most people hear, oh, like my tongue is fine, like what are they gonna do? But it will make a dramatic difference if you've never used it properly in your posture all day long, how you nasal breathe, how well you nasal breathe, and kind of bringing that in is huge. The next place would be like the functional dentist, orthodontist. Sometimes even like people's primary dentists are very well aware of these things. So I think that the next thing is kind of, what are people willing to do? You know, do they have a crossbite, underbite, overbite, high arch palate? Do they just feel like their tongue doesn't fit in their mouth? Like, what are people willing to do, or what do they want to do as far as resolving their airway issues? But I think in this world, it's really doing your homework, understanding the different procedures that relate. SARPE, MARPE, palate expansion, you've got like biomimetic expanders, so you've got like a soma plate, a Vivos DNA device. Some are surgical, some are non-surgical, but oftentimes, you know, if you're gonna do these, finding out what your practitioner does, because a lot of them just kind of streamline their practice and will use one or two methods versus everything that's out there, which is, you know, totally understandable. Training a staff to be versatile, to use everything, takes a long time. So I think a lot of times products get watered down because people don't have enough training on each of the tools, and then as a result, they use them half-ass and people get half-ass results. So I think a lot of doctors will do a few things, but they do it well, and it's just making sure that what they do well might be what you need to have done. But in this world, you know, oftentimes if you're gonna do like some kind of palate expansion, you know, they'll work with basically an ENT, or they'll work with a facial surgeon as a team in conjunction with what they do. So a lot of times you'll see, let's just say you start with the orthodontist, and then after what they see, they'll then send you to, let's just say, the facial surgeon, and then making sure that what the orthodontist sees is in line with what the facial surgeon thinks is possible. Because someone up here can promise you the world, but if someone that understands the deep mechanics and science of how the face and jaw works says, yeah, that's not realistic, you know, then it starts to become, okay, like, why is the facial surgeon telling me that this isn't realistic? And, you know, I should probably go get another opinion. And this is where, like, kind of, yeah, you might have to go see some doctors. And trust me, it's frustrating. But I think one of the things with it is making sure that you get things done right the first time, and that you're not chasing doctors to fix other doctors' mistakes. But I think when it comes to this, more and more orthodontists that used to just kind of fix people's smile, I think are starting to more so make airway first, teeth second. And especially when it comes to this world, you know, one of the biggest things I've learned is, like, there's some awesome doctors out there that are like expanding kids 3 and 4 years old nowadays. And I think basically we don't have the nutrient quality that we once had in our food. We don't chew like we once did. So the building materials for our jaw, combined with lack of chewing and strength, has left us with less efficient stimulus to grow our jaws and airways out like we once did. And as a result, it's my belief in the next 10, 20 years that, you know, they'll probably just start expanding young kids just to give them a chance. But I mean, if your kid's 5, 6, 7 years old and they don't have lots of space in between their teeth, there's already crowding, it tells me that someone hasn't pushed out the teeth. The tongue hasn't pushed out the teeth enough to give the room adequate space so that the furniture fits. I think oftentimes, not knowing about this, we have no context about, like, well, is this good? Is this really good? But I mean, I saw a dentist out in Chicago a few weeks ago, and her daughter's 4.5 years old. I saw all this stuff because I was messaging with her that she did for her young child to stimulate basically that which we used to get when we didn't have all these soft foods. And basically her daughter just over 4 years old, her intermolar width in her maxilla, her upper jaw, was 33 millimeters. And then within 2 months, she expanded her daughter's jaw to 38 millimeters. So to give context to that, here's a 4.5-year-old with her jaw being 38 millimeters. And I've got 3 employees, because I own a gym, that were college athletes, and she already has a bigger jaw than 3 of them. One of them has sleep apnea. The other guy wakes up at 28 years old takes him 15 minutes to unlock his jaw, teeth grinding. And then we've got another guy that had basically a tongue tie who's 6'4", and grew up in a small town, was told it was fine. But like, these are some of the things. And when you've got a 4.5-year-old whose jaw is already that big, there's a chance by the time she's 18 that her jaw is 45, 50 millimeters wide. So a few things, like one, the wisdom teeth might fit, which is awesome, but it starts to tell us that, like, okay, we're putting this kid's jaw on the right trajectory for development, but more so to provide adequate tube size when it comes to the plumbing. So the back of the airway, the nostrils, the jaw is wide. All of these things are mechanically important to help us breathe. More so even on the front end of life, but on the back end of life. Because it's like, if we basically are built for a V10 engine, and by the time we're 18, we've only got a 4-cylinder, we're stuck overworking our system for the rest of our lives. And then as our body deteriorates and becomes less efficient, we have that coupled with a small engine, and we wonder where chronic health issues come from. But if we can't breathe, we can't regulate our nervous system doesn't feel safe, it's taxed out, we blow out our immune system, all these things matter. So I think it's important for parents to really read up on this, that, there's a Kevin Boyd, he's a pediatric orthodontist out of Chicago, but he's expanding kids 3, 4, 5 years old. But I believe that it's going to become a thing. Even my niece, who was living in Oregon for a while, 7 years old, she was expanded, and at 12 now, her airway is at 38 millimeters. Once again, here's a 12-year-old girl that has a bigger jaw airway than 3 grown men that played college sports. But setting your kids up for success in this world is huge, and understanding that it's never too early to go get an opinion, and then maybe read up on some stuff, and maybe you get an opinion, you read up on some stuff, and you start to question the opinion you heard. But ask questions. You'll know when you've met the right doctor or practitioner and when it's time. And this is one of those things for young kids too, especially if they're, you're catching these kids snoring, they have a hard time sleeping, they don't wake up feeling rested, that, the myofunctional therapy is also a great avenue. But teach your kid how to use their tongue. When they're young, their palates are soft like wax, and we can train the tongue to really start to work the way it's supposed to. And what that does is push the jaw forward and upward, holding it like scaffolding. So as the bone is laid down, that we have these wide kind of jaws that are held up, which is how we get cheekbones. This is how we kind of develop and have a large airway, but that's really important. I think one of the other things that's really important is, like I said, you can't find all these people depending on where you live, but either a PRI practitioner or a craniosacral therapist, but just kind of someone that really understands all the deep mechanics when it comes to breathing, posture. I think one of the things that I see a lot is people's nervous systems are not ready for some of these procedures. They've got taxed out nervous systems because their bite is so off. They clench, grind, their posture is terrible. But one of these practitioners basically can kind of help your body get in the right mind frame to kind of do some of these procedures. Once again, I know these are a lot of different things, but they're all components that matter. And as I've grown over the last 40 years and read more and more and more, it's kind of like seeing how A helps B to be more successful. You know, C helps D, but like they work in conjunction with each other. And it's kind of one of those things where the more pieces that you have in the right direction, the probably the better success. And I understand there's a financial component to all of these things, and this is where educating yourself a decent amount up front and reading can probably help limit some of your spending, and then seeing, you know, what you do have to spend based on what you know, like where's my money best spent to at least take a shot at this. But with these practitioners, you know, realigning the body, getting the nervous system out of a fight and flight pattern, and all these things can happen as a result of teeth grinding, a crossbite, overbite, underbite, because the teeth need to line up, the molars and canines. If they're not, it's kind of like a holster. When they match up over one another properly, our nervous system feels safe. We're able to balance our head over our neck, and as a result, the body can kind of feel at peace. But when we have these bodies that are compensating, airway's too small, tongue doesn't sit on the roof of the mouth, the nervous system is in this taxed state, and oftentimes returning it to a more neutral state will allow some of these other things to have more stickiness when they're approached. I think one of the other important things is someone that can help kind of restore functional breathing. I would assume most people, if they were to come stand in front of me, don't breathe properly. And I think until someone proves they can, they should almost assume they can't. And so much of this has to do with just how we've been brought up, modern day society, undersized jaws, bad tongue posture, not getting proper sleep, allergies. All of these things kind of have an effect on how we breathe and our mindset. But the biochemical and the mental side to our nervous system as it relates to breathing is very important. And so having someone that can kind of get that more dialed into a neutral state is going to prepare the body for whatever it does next. Even if that's something where it's like months of this, I think you can do wonders for the nervous system and sleep, because the body's able to calm down, feel safe, and kind of operate with better performance. I think the last piece is like the facial surgeon. So I know my facial surgeon, basically you had to have a referral from another doctor. So in other countries, I'm not really sure how the medical system works. So for me, I started with my orthodontist, then went to the facial surgeon. When I was in New York and the sleep doctor had me go see the facial surgeon, you know, one of the things he told me that I think is really important to this day is that he thought I was going to need double jaw surgery because my jaw was so small. But because I had done the Vivos palate expander prior to doing my SARPI, it had given me enough space in the back of my airway to be able to kind of function well enough that that wasn't something that needed to be addressed. But a facial surgeon should be able to take like a 3D CT scan where they do a 360 view, your airway, your tongue, your TMJ joints, and kind of see the big picture. You know, how small is the airway? What are the possibilities with it? And then from there, they often will give you an opinion based on what they see, you know, like is possible. So maybe you start with this person, or maybe you start here and then you're coming here to see if what the ortho or the dentist said is possible. But all we're doing is like collecting clues, data, information. and then making sure that, you know, we feel confident in what we're being told, that like, hey, this is a good basically next step for me to take. And I can't emphasize enough, like, this world is very complex. There's a lot to it. And, you know, reading, even if you don't even know what you're reading, it's like, that's what I did in the beginning with this. Like, I could tell you all kinds of stuff about, you know, how fast our molars grow and why we have our wisdom teeth removed and what nutrients could help my kid. But it's like, I just read and read and read and look stuff up and read some more and ask some questions and then read some more. But to start to put the pieces together to understand this. But, you know, I hope this gives some perspective on some of the different components when it comes to this. I think the big thing with this is, you know, hearing some of this stuff, go look some things up, and then kind of seeing like, who do I have in my backyard for doctors, practitioners? But my hope with doing this was just kind of give some people some insight as to the different components at play here, and, you know, what to maybe expect when you go see some of these practitioners or doctors, and then understanding that, like, you know, there's nuances within each of these fields, and that maybe who you go see isn't the right solution for you, but when you ask enough questions, you understand why you're asking what you're asking. I think you start to get better answers, and I think you start to shop for doctors more in line with what you're looking to do, so that when you do go sit down with someone, like, they're talking about things you want to hear about, rather than, nope, I don't do that, I don't believe in that, that's voodoo science, there's no science to back that up. But I mean, a lot of this stuff is new, and as a result, there's not money backing studies, there's not long-term. So I think it's like, for some of these guys that are basically paving where this airway science is going in the future, a lot of it is cutting edge. And, you know, like Zagi in LA, you know, he does a ton of studies on tongue ties and airway, tongue tie being removed with myofunctional therapy. But these guys are starting to put together their own research because there's not a ton out there. But, you know, even medical journal articles, it's just starting to read and understand all the different components. But hopefully this helps. I know there's a lot of information on here, but I think for the most part, it's just continue to try to learn more and more every day and ask questions, and I think you'll start to find some solutions. But don't hesitate.